Prior to COVID-19 reaching Jamaica in March 2020, the Ministry of National Security was putting measures in place to protect those in its care, a population of 3,700 within the penal system. The strategy was multi-layered, including measures to prevent or delay the virus from entering any of the 11 adult and juvenile correctional facilities and minimize the impact of any outbreak. So as early as January last year, the Department of Correctional Services, DCS, began sensitization sessions about the potential threat of the virus with key members of its medical team and representatives. In addition, a comprehensive contingency plan was prepared, internal education campaign for staff and inmates undertaken, hand sanitization and wash stations erected, and a COVID-19 task force established. Further to that, measures were taken to stop external visitors from entering the compound, and suitable areas for quarantine and isolation were identified. Minister with responsibility for the DCS, Matthew Samuda, says the wearing of masks and social distancing were enforced daily.
Staff and other persons accessing the correctional centers or any other offices were subjected to a temperature screen, and later a verbal questionnaire was added to this, as most persons were not febrile and the initial measure alone was not effective as a screening tool. A sanitation project was undertaken which involved the inclusion or the increase significantly in water storage facilities across our facilities. Despite these preventative efforts, DCS recorded positive cases of COVID-19 in 7 of its facilities, with the worst outbreaks occurring at the South Camp Adult and South Camp Juvenile Correctional Centers.
With this revelation came heightened safety measures from the Correctional Department's medical team.
They instituted a random swabbing system using a 1 in 3 method. When cases are found, samples were taken immediately from cell inmates. Other symptomatic inmates were also sampled randomly from dorm or block. The staff also maintained a good working relationship with parish health departments, who stepped up to assist with testing in facilities whenever there were positive cases, initially locking down potential spread. Staff and inmates were required to adhere to quarantine orders, and new admissions were segregated from the inmate population for 2 weeks and monitored daily for infection. Like all penal institutions, the DCS is designated as high risk for outbreaks of infectious diseases.
As at April 1, 2021, a total of 880 inmates and wards were tested for COVID-19. Of that number, 739 tested negative, while 141 were positive. At that same period, recoveries numbered 126, with 15 active cases. As for the staff population, 489 were tested for the virus, of which 325 results were negative and 164 positive. Staff recovery from COVID-19 were 149, with 11 being active cases. Unfortunately, the Department of Correctional Services suffered 5 deaths, 3 staff and 2 inmates. Minister Samuda commended the staff for working in a high-risk environment, as well as the medical team for their early detection of the virus and prompt removal of infected persons.
Despite the challenges to our day-to-day operations, they have stayed resolute. They have stuck to the recommendations of the WHO for those who are incarcerated, and they have performed admirably. We have used the basic science in this management, reduced interactions, whether by external visitors or inter-block exchanges. We have put in place the necessary sanitation mechanisms. We have also started the process and in some cases made the infrastructural changes to facilitate greater ventilation.
Inmates were also acknowledged for their involvement in the fight against COVID-19.
Inmates in the management of COVID-19 cases at Tower Street have also been notably successful in their approach. They have worked as medical orderlies, which have helped significantly in reducing spread. Additionally, we trained both staff members and well-behaving inmates to be able to supplement the efforts of our health staff.
Minister Samuda says the fight to contain the spread among staff and inmates was not without challenges. These include staff burnout, anxiety by staff and inmates during periods of outbreaks at facilities, and disruption to in-person rehabilitation activities and court hearings.
We've had to turn chapels into isolation spaces and quarantine spaces. We've had to turn classrooms into hospital spaces when we've needed to, which have affected how the prisons are operating. So the things we have had to do to prevent, well, to prevent entry, prevent spread when we've had entry of the virus into our facilities, to provide the care required, are things that we know we had to do, are things that all of the recommendations from all of the globally recognized agencies said we were to do.
The Ministry of National Security says despite the challenges posed by the COVID-19 pandemic, the Department of Correctional Services has mitigated the effects admirably. This relative success is due to foresight and planning of the leadership team. The ministry assures that lessons learned over the past year in dealing with the pandemic will be used to counter any future challenges that may arise.